All right, so what to expect on your first appointment? When you come in, you're gonna come up to our front desk and greet our lovely assistants here, Kim and Tabitha. And then hopefully you've done your intake ahead of time. You would have received that online. And then you'll go ahead and have a seat. And within a few minutes, they're gonna have you sent back to a room with the doctor. So the doctor will come grab you and then come with me. And we're gonna come back in a consult room. Go ahead and have a seat here for me. And then we're just gonna take a few minutes to do a focused consultation here. So we wanna find out what's going on, what's got you stuck, and how we can get that taken care of for you so that you can get back to living the life that you deserve. After we do our consultation, one of two things is gonna happen. If it looks like we can help, we'll tell you, and we'll let you know any fees associated with further testing, treatment, things like that. And then if it looks like you're a better fit for somewhere else, we'll let you know what we think your next best step is. If we're going to proceed here, we're going to go ahead and do a neurostructural exam. What a neurostructural exam is a series of biomarkers. So first we're going to get your baseline blood pressure. Then we're going to do global range of motion. So we're going to do motion here, motion in the low back, see where any restrictions are, pain, discomfort, functional anomalies, things like that. After that, we're going to do palpation. And then we're going to do a single leg stance where we're going to assess how the brain and the body is talking to one another. That test is really huge for any sort of disc or even mild neurological dysfunction. Last but not least, we're going to go ahead and do a bilateral weight scale here, and this is going to tell us how stress is hitting the body. So after that, we've got all that data, and then in many but not all cases, we're gonna pop across the hall and go ahead and get some x-rays here. So when we come over here, there's a couple different types of digital on-site imaging we do. The most common would be x-ray. But what's unique about the x-ray we do is that we want to do a motion study. So we're going to see how your body's moving. When we see where that restriction is, we know right where we need to go to fix things. Because here at Action Wellness, we want you to get the best results in the shortest amount of time. Now, we can also do a digital posture analysis. We've got a 3D foot scanner that talks about that foundation of the spine and where challenges with the feet, the arches can go into the knees, the hips, even the shoulders and the head and create tension there. We look at a whole body approach. And last but not least, we've also got some of our movement screens. So we've got a functional squat screen, deadlift, some very athlete-oriented for either sports injuries or optimizing peak performance. After we do our x-ray, if that's what we're gonna do on that visit, we're gonna come out and do any treatment indicated if that's what you want. You are always in the driver's seat with that. We'll tell you what treatment is safe and indicated at that time, and then it's up to you if you'd like to get treated on that first visit.